Thank you for joining us today. I'm going to speak about the Quality Assurance Performance Improvement Program, also known as a QAPI. And we're going to go through the steps today that you're going to need to follow to make sure you've got an effective QAPI plan, that you've implemented it, and that when you have your survey, you can demonstrate that you are able to have a functioning QAPI program that meets the standards and the requirements. So first of all, we're going to talk about the program elements, hopefully provide you with a better understanding of why the QAPI is so important. We're going to look at the different standards from the two accrediting bodies that we work with. We're going to review the committee and their responsibilities. We're going to look at some common quality indicators and identify how you're going to know which ones to pick, how you're going to follow them. We're going to talk about your committee membership, how often they meet, what needs to be reflected in their minutes. And then lastly, we're going to talk about your annual evaluation. Again, all of these elements are ones that we frequently see on deficiencies during the time of survey. So we want to make sure you have a good understanding of how to be compliant. One of the things that we always hear from our clients is how complicated QAPI is. So this slide, I've attempted to just make it really simplified for people out there that have not done QAPI or been involved in any type of performance improvement before or never really understood it. Really, QAPI is just all of the activities that occurred during the previous 3 months or a quarter of your agency activities that might put you at risk or be some type of undesirable event that happened. So you're looking at those events that happened, whether they're needle sticks or they're falls for patients, infections, maybe not following your policies, not doing the paperwork correctly, not following the plan of care, any of those types of things that are not correctly done. You're looking at those, the committee's looking at those to see if there's any common reason why those things occurred. And if so, moving forward, what type of plan or what type of activities are you going to put into place to keep these events from happening again and possibly putting you at risk? Again, when we're looking at undesirable events, that's anything that might put your agency or your employees and the patient at risk of either being harmed or injured. So again, every agency, whether or not you're going through accreditation for your Medicare, and also some states require that you have a QAPI program. And the program itself is what is implemented through your QAPI committee. So you have policies, you actually have a whole section of policy manual that talks just about QAPI and what it needs to look like and how you're going to follow that. And it's up to the QAPI program or committee to implement all of those policies. Again, the program is focused on patient outcomes. We look at all the outcomes and we measure them against what our thresholds are that are acceptable. And then we also have a written plan of how we're going to implement that program. Every year, at least once a year, the QAPI committee looks at the plan for its effectiveness and implements or revises any changes that needs to happen. The QAPI program has certain mechanisms that are followed to ensure that the program is effective. Some of those are identifying problems and how problems are going to be identified, and those are through certain activities and documentation that the committee looks at, whether it's logs, whether it's chart reviews, personnel chart reviews, incident reports, satisfaction surveys. All of those are documentation and elements of the program that they evaluate every quarter to identify problems. Once they've identified problems, then they will recommend appropriate actions that need to be taken to improve or eliminate those problems. And then also they will make sure that there's implementation, and that's done through a joint effort with the PAC committee. The QAPI, again, is a system and that's going to measure the outcomes to make sure that there's optimal care being provided and that the agency has minimal events that could put them or put you at risk of either a lawsuit or losing your license or having a bad survey. Also, the measures that are evaluated include appropriate items that specifically talk about the scope of services that you're providing. So if you're providing nursing and therapy or social work, all of those services that you're providing will be included in the measures that the QAPI committee is looking at. Again, this slide just talks about some of those items that we're looking at. There's much more, but records for both your employees and your patients, patient satisfaction surveys, particularly we're looking for negative patient outcomes and patient complaints, incident reports, infections, rehospitalization, med errors, employee injury. So you can see where, negative reports on any of these items could put you at risk of having an issue that you're going to need to deal with. The next two slides talk about the specific standards that address the QAPI. And again, these are written in line with Medicare, the condition of participation. But again, even if you're not doing Medicare and you're doing personal services, most of the states are requiring also that the agency is doing some type of quality assurance performance improvement to make sure that you're providing quality care to your patients. That was the ACH one. This is the CHAP, so you can see where they're very similar. But again, both of those talk about looking at analyzing outcomes and making sure that quality care is being provided, and if not, that the agency is looking at developing some type of performance improvement process to improve those outcomes. So for the committee, at a minimum, you're going to have your administrator or agency manager on that committee. If you're doing skilled, you're going to have the director of nursing or supervising nurse or whoever that supervisor is. If you're doing personal services, then it would probably be your supervisor. It might be your agency manager. Also on the committee, you're going to want to have at least one individual that represents each scope of service that you provide. So if you're providing nursing, you would have a nurse, physical therapy, OT, speech, MSW. Again, each one of those disciplines need to be on this committee. Also, you'll note that some states require additional individuals to serve on this committee. We've seen states that require a pharmacist, maybe a dietitian. So when you're reading your policies, you'll want to look to see state-specific what additional individuals you need to serve on this committee. So again, responsibilities of the committee. Again, their biggest responsibility is that they're going to develop the QAPI program that covers all the aspects of care that you're going to provide. It's approved through the PAC and then finally through the governing body. They're also going to identify in this plan the aspects of the care that's going to be provided, what kind of tools are going to be used to monitor and evaluate the aspects of care. The indicators are developed, and inside those indicators, and we're going to look at a few of those later on in the program, they'll identify criteria and thresholds that are acceptable for these indicators. Also, we'll identify what type of data that you're going to look at to understand if you're meeting the thresholds and the criteria for the indicators. This committee also will formulate the evaluation tools. We provide those to you, but you're certainly welcome to develop more as you move along, maybe some more specific as you develop more quality indicators. And then lastly, the responsibility on a quarterly basis is to evaluate all that data, analyze it. They're looking for trends, things that are happening more than once or twice in that quarter, and then implementing an action plan to help correct that. Some of the more of the activities that they do is, again, they act as an advising or consulting with management, and that's why you have multiple disciplines on this committee, so that you get input and recommendations from different aspects of patient care, not just nursing, not just administrative. They're looking at, like we said before, incident reports, questionnaires, whether it be from patients, physicians, referral sources. And again, they're monitoring that and evaluating those results and comparing them to the quarter before to see if there's improvement or if now there's an issue that there wasn't before. Once they've had their quarterly meeting, they formalize their report through the minutes, and they provide that to the PAC committee, Professional Advisory Committee. And then from the PAC committee, they will approve or disapprove the action plans that go then on to the governing body for final approval and implementation assignment. Again, all of the QAPI information should be maintained in a confidential manner because there is a lot of not only employee sensitive information but also patient sensitive information. So all of the QAPI logs and documentation and minutes and so forth really should be kept confidential. So for the committee, when it first is formulated, the governing body will appoint all the members of the QAPI. And that's really true of all of the committees, that the governing body has to appoint them. If there's ever a time when a member needs to be replaced or added, then the governing body has to meet and revise that membership, and that should be reflected in their minutes. The committee meets quarterly. It should follow the record review committee. Again, every quarter there should be a minimum of charts that are reviewed at the record review committee for both active and closed charts, and that they reflect a cross-section of all of the patients that were serviced that previous quarter. There's minutes for each meeting. The minutes need to be signed by the QAPI chairperson. We provide you with templates for those minutes, but that moving forward, those minutes are going to change. Please don't just use those templates and just not add or change those up. So when the surveyor comes, We've had some complaints that the survey or, the minutes for 3 years all look the same. Well, that can't be. That shouldn't be. So you do need to read those and make them very unique to your agency. The other thing is every time the committee meets, every member of the committee should be signing the sign-in sheet. If they're absent, the chairperson should note that they're absent. And if for some reason the committee member attends by phone, then the chairperson should note on the sign-in sheet that they've attended by phone, which is acceptable for the QAPI. There's really not a way for them to attend by phone for the Record Review Committee, but they could for the QAPI. And the accrediting body and Medicare requires that these meetings minutes are retained for 5 years. So some of the questions that we get are, how do I choose my quality indicators? At the back of your QAPI policy section that we talked about, we have given you probably about 30 or 40 indicators. They're just a sample of some common ones that you can use. You can either use them as is or you can change them as you like. But you need to go through and at least read those and be familiar with how they're set up. So at the beginning of each year, the QAPI committee should be identifying 2 to 3 quality indicators. Those indicators are going to be followed for that year, and we're going to look at a couple of those examples in just a couple of slides. So the indicator, when choosing these indicators, the committee will look at what type of volume is being performed and what risk that you may have for that indicator. So an example might be one of the requirements is that the patient is admitted within 48 hours of the referral. That's a pretty high volume indicator. It does put you at risk, particularly if you're billing Medicare. You need to make sure that you're doing that admission within that 48-hour window. If not, that there's documentation of why that's not happening. So that would be an indicator that a Medicare agency most definitely would want to keep track of. Again, as those indicators are chosen, the QAPI committee is also going to look at any trended results from the previous year. So if the QAPI committee knows that there's been a lot of needle sticks from the year before, or maybe a lot of rehospitalizations, then more than likely that would be a prudent indicator for the QAPI committee to choose for the next year to monitor, because that's something that's going to put the agency at risk if it continues or if it becomes more of a problem. Auditing at a minimum must include patient satisfaction surveys and chart audits. So even if you don't pick those for your quality indicators, those 2 items are things that are going to be audited ongoing. Those are never going to go away. So here's some examples of the QA indicators that are in the back of your QAPI policies. We talked about patient being admitted to service for Medicare and some of the other agencies that are being accredited. That's a 48-hour window. Other states also have a timeline, whether it's 2 days, 5 days. So you need to be familiar with your admission policy in your patient care policies. Patient teaching, again, this is more of a skilled indicator. Documentation. I've got skilled nursing notes on the slide, but it could be documentation by your home health aide, by your companion, by your physical therapist. So that could be for any agency. The annual performance evaluation, that talks about evaluating your employees, making sure that they're following policies and that they're executing their job description. Hand washing techniques, patient satisfaction surveys. These are really important. Again, that's going to be one you're going to follow regardless of the results on a yearly basis. Missed visits are in there. So if the patient is not being seen or the client's not being seen in accordance with what's on the plan of care or what they've requested or what the doctor's ordered, what's being done about that? How often is that happening? And what's being implemented to prevent that from happening? And then wound care. Again, this is more of a skill, but, are there wound care orders from the doctor? Does the documentation reflect the orders for the wound care? This is an example of one of the indicators that's in your QAPI policies. This is the one, patient admitted to service. So you can see we've identified the indicator. By the indicator, it just is a snapshot of what your policy states. So for this particular one, it states that the patient's going to have an assessment completed or initiated within 48 hours of the referral. If it's not, then there's going to be documentation otherwise. The initial assessment is going to be done by the registered nurse, physical therapist, OT speech. The standard agency assessment is going to be used. So we would be looking at what admission forms were used. And that, lastly, number 4, that we've followed the admission criteria policy. The threshold for this particular one is 90%. So we expect for these patients to be admitted to service according to our policy 90% of the time. We're going to look at our sample. We're going to review at least 10% of all our referrals. Okay, that's going to be an audit. And that's going to be done, the methodology for looking at this quality indicator will be the chart reviews. And that's going to be done either by the director of nursing, if it's a skilled agency, or a designee. So it might be for a personal service, it might be the agency administrator, or possibly somebody in the office that the agency manager has designated that task to. Results of those chart audits are going to be given to the director of nursing if it's a skilled agency, or the designee. And again, with some follow-up and an action plan developed as needed. The next one, again, just to give you another example, this one talks about patient infections. We want to make sure they're controlled and prevented as much as possible. So we're going to be looking at patients that develop infections after an admission, and we're going to be looking at what type it is, was there treatment, could the agency have prevented the infection, and what caused the infection. The threshold or acceptable threshold for patients, and we know some patients develop infections regardless of what we do. We have no control over it. But the threshold is we're wanting that to be less than 5% of our patients that are admitted or clients that are admitted. Again, our sample size is going to be 10% of our referrals. And we're going to be looking at not only chart documentation, but also our infection control logs. Each agency should be documenting any time patients develop infections once they come on service with you. Results are going to be submitted to either the director of nursing or a designee, and they're going to be looking and identifying correlating problems and trends from those infections. So once all of the documentation is reviewed by the QAPI committee, and some of this includes the chart audits, logs, that's all of the logs that you're going to keep. That includes needle sticks, falls, rehospitalizations, infections. They're also going to be looking at any incident reports for the quarter, any employee injury reports. This was employees that were injured on the job that required more than first aid. So it could have been a fall, it could have been a car accident, it could have been a needle stick, it could have been an exposure to blood or body fluids. Also going to be looking at patient satisfaction surveys and any other documentation that's specific to the indicators that you're currently following. And again, in the technology section. So they're going to review all of the available documentation, and what the committee is looking for documentation are what we call trends or problems. You know, did we have 4 patients that developed symptoms? Items that occurred more than once should be considered a trend, and there should be an action plan developed based. Now, I have seen some action plans developed when there was only one event that occurred, if it was significant enough. And that might be something significant, that a patient was abused by a caregiver, a significant injury to your employee where they were hurt on the job. So that might be significant enough that only one event happened. That was documented to determine that action plan necessity. Once the action plan is developed by the QAPI, that's going to be communicated to the PAC. And that's going to be done in the minutes of the QAPI committee. When we develop an action plan, we're looking at some of the following elements that should be included. First of all, we want to identify the trend or the problem. We want to identify specific actions that need to be implemented, either to improve the problem or trend or eliminate it, if possible. Also in that plan, we're going to include who's going to be responsible for implementing and monitoring the plan. Usually it's going to be the key people that's going to be responsible. Usually is either going to be a director of nurses, your supervisor, or your administrator or agency manager. You need to have somebody in a key position. Also, you want to make sure that when you're creating that action plan and implementing it, that all of the individuals that are involved are educated as to that plan. So if it involves a certain technique on how to transfer a patient, if you've had a lot of patient falls, then you want to make sure that you've re-educated all of your aides or your caregivers so that that they can be a part of that plan as well. You want to include a date that the plan is going to be implemented, and then also when that plan is going to be reevaluated to see whether or not it's been effective or not. If the plan's not effective after that date, then there needs to be a revision to that plan. And usually that, again, depends on the seriousness of the issue that's being addressed and the plan. Typically it's every quarter. However, it could be more often if it's something of significance that needs to be evaluated before that end of that quarter. And again, lastly, the action plan needs to have some indication of what results you're going to be looking for that's going to indicate that the plan was effective. And again, it gets back to those thresholds, and it may be as simple as, you know, there will be a reduction of patient falls from 5 to 1 or to 0 or whatever those results you want it to be. Again, when you're picking those plans and developing those plans, make sure they're reasonable and something that you can follow. If you develop a plan that's absolutely nothing, that you're not going to be able to meet those plans, it's going to be frustrating for you, and that you're constantly going to be revising action plans to meet an unreasonable threshold. So for follow-up on the action plan, every quarter the QAPI committee is going to re-meet, and they're going to be looking at all the indicators from the quarter before. to evaluate whether or not those plans have been affected. And again, they're going to look at the acceptable thresholds that's on the indicators or that the plan has indicated or been documented. If the problem has not been improved or has become worsened, the committee is going to make recommendations for the action plan to be revised. So it may be adding additional activities, maybe retraining, whatever that is that they feel like that needs to be done to improve that problem. If the plan is revised, then the PAC committee is going to be provided with the minutes that includes the new plan so that there can be implementation of that revised plan. In the QAPI minutes, documentation will include all of the occurrences or events that's being monitored and what the results are of those. So patient satisfaction survey, maybe 4, maybe 5, maybe 6 returned, how many negative comments were made on those. Rehospitalizations, there would be an actual number of times the patient had to go back into the hospital once they were admitted. Needle sticks. Again, we give you a template when we provide your minutes to you, and we list down all of those events or the common events and occurrences that you should be recording and looking at. Also in the minutes, there would be a status of the action plan, and this would be something in the form either it was effective for the quarter as evidenced by whatever that is, less falls, less needle sticks, no infections, or the plan was not effective, and how that plan is going to be revised, and that the revised plan will be forwarding to the PAC committee for implementation. One of the things that the accrediting and state surveyors like to see is that you have some way of grafting your effect or your results of your indicators and your documentation. And it's real easy for you to see too, and the staff to see how that's improving. This is an example of one that I created. So you can see I've broken out for each quarter for 2015. And we were looking at patient falls, rehospitalizations, needle sticks, and complaints. So you can see how those got better or got worse or stayed about the same. So again, it's a good visual. This doesn't replace the action plan, but it does give you a good visual on where you are with the indicators that you're following. And these are pretty easy. This one I just created in PowerPoint. So it's not that hard to develop, and you can make them a lot fancier, but really you want to kind of keep it simple so you can see the results quickly. So what happens when you want to discontinue an indicator? Again, you've had an indicator, you've been following it. We recommend that you follow it for at least 4 quarters. This is going to be documented in the minutes, reflected in your minutes every quarter. And for 4 quarters, this indicator, either you've met or you've exceeded the acceptable threshold. The committee acknowledges that based on that information and that documentation, that they don't feel there needs to be additional monitoring on the action at this time. Now, that doesn't mean that if you discontinue an indicator that you're not going to still continue to monitor it, and that at some point down the road, this indicator may become important again. You may have issues with it again, and you may need to re-implement an action plan for that indicator. But it just means that you're not going to be devoting as much time to looking at that indicator and looking at an action plan for that particular indicator. The committee then would make the recommendation through the minutes that they're requesting or making the recommendation to the PAC committee that this indicator is going to be deleted and why it's going to be deleted. And again, so then the PAC committee would document in their minutes once they meet, that they've approved the discontinuation of the indicator that the QAPI recommended. There's also going to be times when you're going to be adding indicators. And again, those additions are going to be reflected in the QAPI minutes. Documentation in the minutes support why there's a need to add an indicator. Usually this is going to be because of a trend that was identified off of the documentation or that was reviewed during the quarter. The committee then is going to identify the indicator and develop the action plan. The action plan is going to be recommended to the PAC, who's going to approve it, and then that's going to be documented in their committee meetings. And remember, all of those elements on that action plan need to be included for it to be effective. The other key responsibility of the annual QAPI committee is creation of the annual evaluation. And again, the annual evaluation is what ties in all of the results of the QAPI results for a year. There's other things on the annual evaluation, but this is a big part of what is included in there. The annual evaluation is kind of the report card. Think of it as the report card of the agency for the previous year. There's going to be items on that evaluation like how many patients did we admit, how many patients did we discharge, how many referrals did we not convert, but then it's going to be all of your chart audits, employee audits, and then all of your falls, you know, how many negative patient comments did we have, how many needle sticks did we have, how many employees left our agency. All of those things are going to be on the annual evaluation. And the responsibility for the initiation and development of this annual evaluation is the QAPI. They prepare it for the PAC committee, who reviews it and then sends it to the governing body for finalization and approval. But again, all of the data collection is from the previous year. Usually the committee will meet, the QAPI committee will complete the annual evaluation during the first quarter meeting of the current year, reflecting the previous 12 months of documentation and information. We do provide you with a template on your thumb drive, and that you need to complete it for your agency every year. Even if you're in a short year, if you're waiting to get your first accreditation survey, and you are only in formulation for 2 or 3 months the year before, you still need to do an annual evaluation for those few months. And we do provide you one where you did not have any patients. So that would be, that evaluation that year would just be usually formulating your agency, getting ready for a survey, applying for your license, those types of things. But the surveyors will ask to see this and expect it to be one in place for every year that you've been in existence. This is an example on this slide of what the first page of the annual evaluation looks like. So you would go in and fill out the year at the top there, put in your agency name and your state name, and then again, just go through the whole, it's about a 4 or 5 page document that needs to be completed. And then once it's completed and forwarded from the PAC to the governing body actually, the chairperson signs it, and then it's reflected in the governing body minutes that it was approved, and then it's placed with the governing body minutes for reference. So in review of this instructional video, I just want to say that QAPI is an activity that you need to do throughout the year. It's not something that you can do at the end of the year. It's certainly not something you can do at the end of 3 years when you're getting ready for your reaccreditation survey. because you can't make this stuff up on the fly. It's something that you should be doing, and it's something that you should want to do, because you want to use it to make sure that you're providing quality care to your patients, and that you're also, as a business, you're being effective and efficient in your operations. If you're not doing performance improvement and looking at quality assurance, you're not probably going to be a very effective agency. That could lead to some financial and also potentially lawsuits if you're hurting patients, or it could be an employee lawsuit if a patient or employee is getting injured on the job. And the other thing is as you move forward and you want to contract with different payers, whether it be commercial insurance companies, workers' compensation insurance, they're going to all ask to see and look at your QAPI results to know what you're doing for performance improvement and ensuring that you're providing quality care for your patients. So it's very important that you have that and that you understand what your QAPI is all about and that you're invested in having a good QAPI program. Also, again, if you're going through an accreditation process, they're going to be looking at those results every survey. And they're becoming very strict on making sure, particularly on the reaccreditation survey, that that's been in place and that it's not just a fluff program, that it has some meat to it, and that you're actually following all the pieces of that program. So as follow-up, I want to encourage you guys to be familiar with your QAPI. Call us with questions. You have a clinical coach for each state. So if you're not sure who that is, you can call the clinical department and ask, who for your state is your clinical coach, so that we can answer additional questions about your QAPI. We do go over the QAPI when we do your site survey with you. But if you have questions in the meantime, then I encourage you to give us a call so that we can help you through that process. So have a great day. Appreciate it, and you guys take care.